In the 1960s, the world stood on the edge of a groundbreaking medical revolution. People with heart conditions that were once seen as a death sentence were now given a glimmer of hope. But this hope was not without its challenges. It took years of trial, error, and persistence to reach the monumental moment when the first successful heart transplant was performed. It was a moment that not only changed the course of medicine, but also gave birth to a new era of possibilities in organ transplantation. Imagine the world without heart transplants. It sounds like a distant memory, doesn't it? For most of us, we take for granted the ability to receive a life-saving heart transplant when our own hearts begin to fail. But just a few decades ago, such a concept seemed impossible. It wasn't until 1967 that the first successful heart transplant was performed, forever changing the way we think about organ donation and heart disease. The man behind this revolutionary procedure was Dr. Christiaan Barnard, a South African cardiac surgeon whose name would soon be etched in medical history. On December 3, 1967, Dr. Barnard and his team performed the world's first successful heart transplant at Groote Schuur Hospital in Cape Town. The patient, Louis Washkansky, a 53-year-old man suffering from heart failure, received the heart of a 25-year-old woman who had tragically passed away in a car accident. For Barnard, the transplant was nothing short of a miracle. It was a procedure that had never been attempted before, and yet it marked the beginning of a new era in heart surgery. The challenges they faced were immense. The concept of organ transplantation was still in its infancy, and the techniques required to preserve and transplant a human heart were rudimentary at best. Yet against all odds, Barnard and his team made history that day. But as incredible as this achievement was, it wasn't without its complications. Louis Washkansky's body, unfortunately, rejected the transplant after just 18 days. Though his life was cut short, his transplant was a success in the eyes of the medical community. It proved that heart transplants were possible and opened the door for further research and improvements in organ transplantation techniques. In the years following the transplant, Dr. Barnard and his colleagues continued to refine the procedures involved in heart transplantation. With each surgery, they learned more about how to improve organ preservation, prevent rejection, and give patients the best chance at life. And while there were many hurdles along the way, the heart transplant became more refined and successful over time. By the 1980s, heart transplantation had become a well-established procedure in many parts of the world. Thanks to advances in immunosuppressive drugs, which help prevent the rejection of transplanted organs, the success rates of heart transplants skyrocketed. What was once considered a last-ditch effort to save a life became a standard medical practice, saving countless lives in the process. Heart transplants became a beacon of hope for millions who had previously been given no chance of survival. The medical community saw the profound potential in heart transplantation, and it was clear that this revolutionary technique could change the lives of many. Hospitals and medical teams across the world began to take up the challenge, learning from Dr. Barnard's groundbreaking work and improving the process. However, the path wasn't always smooth. As the heart transplant procedure spread globally, doctors faced the inevitable problem of organ rejection. The human immune system is a remarkable defense mechanism, but it is also capable of rejecting foreign tissue, including transplanted organs. This became one of the key challenges to overcome in heart transplants. Fortunately, research in immunology and the development of immunosuppressive drugs in the 1980s provided new hope. These drugs, such as cyclosporin, helped to suppress the immune response, allowing patients to keep their new hearts and giving them a chance at a full life. Yet even with these advancements, the early days of heart transplantation were fraught with uncertainty. Organ shortages became a significant issue. Even though heart transplants were saving lives, there were simply not enough donors to meet the demand. As a result, patients waited for years, often in declining health, hoping for a match. The importance of organ donation became evident, and the need for more awareness and education around this issue became a central focus for medical professionals and organizations alike. Despite these challenges, heart transplantation had undeniably changed the trajectory of modern medicine. The success of these operations brought hope to those who otherwise had none. But this was only the beginning. With every successful transplant, doctors were learning more about the intricacies of the human heart, the rejection process, and the long-term care needed for transplant recipients. These lessons paved the way for even more advancements, and the field of organ transplantation expanded to include not only heart transplants, but also kidney, liver, and lung transplants. The success of heart transplantation also led to significant breakthroughs in surgical techniques and post-operative care. Surgeons began to perfect the art of heart transplants, learning how to handle the heart delicately, minimize damage during the procedure, and improve the chances of success. Medical teams became more skilled, and the mortality rates for heart transplants began to decrease. As the years went by, the stories of heart transplant recipients began to inspire others. People who had once faced certain death were now able to live longer, healthier lives. These patients often went on to lead active, fulfilling lives, demonstrating that the power of medical innovation could truly change the course of human existence. By the early 21st century, heart transplants had become a routine procedure in hospitals around the world. The success rates were higher than ever, and the number of lives saved was immeasurable. However, the journey wasn't without its continuing challenges. As the demand for organ transplants grew, the supply of available organs remained a limiting factor. Medical professionals and organizations continued to stress the importance of organ donation and worked tirelessly to address the gap between supply and demand. Additionally, long-term care for heart transplant recipients became an area of focus. While many patients went on to lead healthy lives, there were still risks associated with the lifelong use of immunosuppressive drugs and the possibility of organ rejection in the future. The field of transplantation continued to evolve, with researchers focusing on improving the quality of life for transplant recipients, minimizing the side effects of immunosuppressive drugs, and finding ways to reduce the risk of rejection even further. Today, heart transplantation is considered a standard and life-saving procedure. Yet the history of its development is a testament to the dedication and persistence of those who believed that the impossible could be made possible. It all began with Dr. Christiaan Barnard and his groundbreaking surgery in 1967. Since that day, the world has seen the incredible power of human innovation, and millions of lives have been saved as a result. The first successful heart transplant wasn't just a medical achievement. It was a triumph of human perseverance and innovation. It was a moment that demonstrated the power of science, determination, and hope in the face of seemingly insurmountable odds. And while we have come a long way since that historic day in 1967, the journey is far from over. With each new advancement, we move closer to a future where heart disease is no longer a death sentence, but a condition that can be treated and managed, allowing people to live longer, healthier lives. The legacy of the first successful heart transplant lives on, and it will continue to inspire future generations of doctors, researchers, and patients for years to come.